like that make us acutely aware of mental health issues here in our state.
But as we grow, mental health treatment and providers just can't keep pace. This is an unexpected consequence of growth in our Colorado, something Denver 7 is committed to help natives and newcomers navigate.
And in tonight's Our Colorado segment, Denver 7's Jacqueline Allen is looking at a bill expected to be introduced this week aimed at helping people navigate the system and holding insurers accountable.
When I was 11 years old was the first time I was suicidal.
For most of her life, Aubrey Boggs has lived with depression. And when symptoms resurfaced recently,
Through my insurance carrier, I started looking for a therapist, and I was unable to find one.
after calling more than 50 people, some weren't actually in network, even though they were on the list. Some didn't have appointments for months. Some didn't call her back. And her insurance company wasn't any help either.
You guys are supposed to be providing these benefits to me. We pay into this. We're supposed to be receiving these benefits.
She's not alone. Mental health advocates say more than 500,000 people in Colorado aren't getting the care they need. And in a state growing faster than most, insurance reimbursement rates for providers aren't keeping pace.
What Coloradans are telling us is that they can't find mental health care.
Andrew Romanoff with Mental Health Colorado says by law, people should be able to access care in 7 days.
When we tell folks those laws and those rules which are now in place in this state, they laugh us out of the room. They say, look, 7 days would be great. But I'd settle for 7 weeks. I've been waiting for 7 months.
But a bill expected to be introduced this week aims to change that. It would first create a state mental health ombuds office, an advocate to help people navigate the system. It would also require insurers to be more transparent because they're required to give equal coverage for mental care and physical care. Advocates say it has bipartisan support.
We've talked to Democrats and Republicans in the House and the Senate who are desperate to do something.
Are insurers doing what they're supposed to be doing from your experience?
Not from my experience, not at all.
Aubrey ended up switching to her husband's insurer to get the treatment she needed, but she says people like her shouldn't have to fight their illness and fight insurers to get the care they're entitled to.
People want help and they seek it out and then they can't get it. And it's really difficult to keep trying when you try so many times and you can't get the help that you need.
In Denver, Jacqueline Allen, Denver 7.